We now come to Shadow Secretary of State Wes Streeting.
Thank you, Mr Speaker. Labour founded the NHS to be free at the point of use, and we want to keep it that way. Given the Prime Minister has advocated charging for GP appointments, and one of his predecessors has also urged the Secretary of State to charge for A&E visits, will the Secretary of State take this opportunity to rule out any extension to user charging in the NHS?
Well, Mr Speaker, I think I can see from your reaction and certainly the reaction of colleagues in the House that is a misrepresentation of the Prime Minister's position. I simply point out for the majority of years of the NHS's existence, it has been run by Conservative governments. We are committed and we remain committed to treatment free at the point of use. That is the Prime Minister's position, that is the government's position.
Wes Streeting.
Thank you, Mr Speaker. I noticed the Secretary of State didn't rule out any future extension of user charging, and I'm sure patients will have noticed too. But given that the Chief Executive of NHS England has said that the NHS needs to expand training, given that many of his own backbenchers are now echoing Labour's calls to double the number of medical school places, and given that he has no plan whatsoever to expand NHS medical school training places, nursing and midwifery clinical training places, doubling the number of district nurses qualifying, or providing 5,000 more health visitors, isn't it time the Conservatives swallowed their pride, admit they have no plan, and adopt Labour's workforce plan instead?
Well, I'm not surprised, Mr Speaker, that he wants to misrepresent the government's plan, not least because his own plan is disintegrating before his own front bench. I mean, not only have members such as the member that spoke earlier talked about how his plans... well, I'm trying to remember her constituency, so I can give her name, Mr Speaker, but in the House one should give the name of the constituency. York Central. My colleague, the member for York Central, has contradicted, as I drew the House's attention to earlier. Not only has his own shadow bench, front bench, contradicted it, but even the deputy chair of the BMA has said that Labour's plan would create higher demand and longer waiting times. I'm not surprised that he doesn't want to talk about his own plans anymore, which is why he's taken to distorting ours.
Who's waiting to talk? Paul Holmes.